The recording has started, and just in case, the schools or anyone else wants to go back and review the meeting, we'll go ahead and get started here. I'm going to go ahead and show the agenda right now, which I had up earlier. Just to go over this, I'm going to go ahead and call the meeting to order. It is now 1:04 p.m. So approval of the agenda, let me go ahead and scroll down. So we have today's date on the 19th, starting at 1 p.m. It's a video teleconference meeting. Meetings are recorded for viewing if individuals have missed the meeting. This is the school health meeting for school year 22-23. And here's the agenda. Part 1 is calling meeting to order, approval of the agenda, approval of the meeting minutes. We have old business, and this portion is really for our reports, our updates from our COVID situational report, COVID-19 updates, PHN updates, school health coordinator update. And then new business, we have the COVID response update, and also the school health index. Others, I put down the upcoming school calendar of events that are happening, any announcements. I'm going to go ahead and change this because it's here. So any other updates from schools that whoever wants to share, and also resources, community resources. Next meeting will be November 2nd, 2022, and then I changed the time to 1:30 Mountain Standard Time. And also looking to have the meetings once a month since we're getting back on track, and I know everybody's busy. So I was just figuring, we just start meeting once a month. And then meeting adjournment. If we could get a motion to approve the agenda. Somebody's okay with that?
Hi, Luana, it's Janelle. I'd like to motion to approve the agenda.
Okay, thank you, Janelle. Can I get someone to second?
Hey, Luana, it's Leisha. I'll second.
All right, thanks, Leisha. All right, and meeting minutes were sent and they were attached to the invitation. So I'm not sure if whoever was here at the last meeting or if you reviewed the meeting minutes, if I can get an approval, a motion to approve the meeting minutes from our last meeting, which was on October 5th. You just joined the meeting. Thank you for being here. I seen Berto get on. Dan, Taniki, Rhonda. Hi, everybody. Thanks for being here.
Hello.
Lula, this is Sasha. I motion to approve the meeting minutes. Thank you.
Thank you, Sasha. Could I get someone to second? And let me bring the and right here are the meeting minutes from last meeting. Last meeting, the COVID-19 situational report was given by Tyree, and then we had Rod do a short update from the PHN portion. He talked about the monkeypox And then I did my school health coordinator, my school health update. And I just talked about all the events that are going to be coming up, what I have in the planning stages. We have program introductions, all the programs that were here. They did a short introduction. And then announcements that are going on in the community. And then we just put down our next meeting and then had an adjournment at 2:12. Would anybody like to second the Sasha's motion to approve the meeting minutes?
This is
Luana,
Janelle.
I
I'll
can-
second.
Okay, Janelle. Thank you. We can go ahead and move forward. And this was also in the invitation invite on the Outlook. So the meeting minutes are attached in there. Thank you. All right, let me go ahead and go here. So next on our agenda is COVID-19 situational report. Situational report. And Tyree's not here. So Sasha said she would be able to give us an update on that. Do you need to share your screen, Sasha?
Do you have the presentation?
She did not send it to me.
Okay,
Okay, let me give her a, we'll just, let me give her a call. And then what we'll do is we'll move to the COVID-19 updates that you have, and then we can come back to the situation report.
okay.
Okay, thank you. Do you need to share your screen for anything?
Yes.
Okay, let me go ahead and stop sharing. All right.
Hi, everyone. It's good to be with you. I'm gonna show you just my graph for the COVID among school age. Let me share that with you real quick. Where is okay. All righty. So we're still tracking COVID-19 in the schools. And still keeping track, still sending notifications to the schools, and it was pretty, I guess, low key for a while, as you can see on the graph. Through the month of September, the numbers were lower, and within the past couple of weeks, we see the numbers trending higher, and that's reflective of even the total number of cases for like adults and kids all combined. So, and it's just not one specific school, it's just random within all the different communities of Winslow service area. Sometimes these numbers are including children who were tested like from, they have residents in Flagstaff. So, but the numbers are going up slightly. So we just want to continue to encourage the schools to be mindful of that, mainly to take those precautions and have kids, parents get their child tested and checked to see if it is COVID, but we also are aware that other viruses are starting to surface since we're back to interacting. A lot of the schools are restarting up their sports programs and restarting up after school programs. You know, there's more field trips happening, so a lot more activities going on. And then we got flu season coming around, so we just want to encourage that you know, the same precautions continue to be enforced with hand sanitizing, good hand washing, and in covering their coughs and staying home when they're sick. We also, you know that other things look like COVID. So the common cold, we had issues with rhinovirus, hand, foot, mouth disease, you know, things like that. So, but this is what we're looking at right now since the start of the school year. And then as far as Navajo Nation, we know that the vaccine schedule has changed. There is now the new bivalent vaccination for COVID. And we're just encouraging adults and children to be updated with their booster shot. So this is how the trend looks at the bottom. You see the graph. And we know this year also that all the fairs and concerts and all of that restarted up. So this is what our numbers look like right now. So that's what I have for as far as data sharing. Luana, did she say what, if she had the PowerPoint prepared?
No, she's actually away from her desk. So what I'll do is email everybody what she shares with me. That way they have that.
Okay. So we continue to have the COVID vaccinations in our main office building. And that's from 8:30 to 4. They do take a lunch break between 12 and 1. So if your staff or parents are asking about getting their child up to date with the COVID vaccine, they can get that there here at Winslow Indian Healthcare. And then we also have COVID testing still continues, our drive-through COVID testing. And another thing is just to encourage our children to be up to date on their vaccination. So flu shots. And then I know recently there's things like chicken pox that come up. And so make sure students are up to date on their vaccinations across the board. And usually if they need a vaccine update and they're well and healthy, they can come to the clinic and go through a nurse visit. But they should have a well child exam as well. That's very important that they get checked for their well child exam. So and then just some other things that we want to direct your attention to. A lot of our updates are on the Winslow Indian Healthcare Center website and the Facebook page. So a lot of our announcements are on there as well. Janelle, can I call on you? Do you know the updated percent positivity rate at this time?
Hi, Sasha. And unfortunately, no, I do not.
Okay, well, we'll get that information to you soon. Thank you. That's all I have, Luana.
Sasha, this is Sally.
Hi, Sally.
Hi, how are you doing?
Doing good.
So I have a question on, you're talking about COVID vaccination and flu and all that. What about the regular polio and DTs and, the boosters for the school-age children? Are you also giving those updating if they need to be updated? I don't know who is actually across the board who is keeping track of all the vaccinations or immunization. And I know with the public health nursing, when they did the report to board of directors, their overall vaccination or immunization levels was pretty low, in 60%. So one of the recommendations from them was to try to increase that. And I think that's why they're scheduling some of the, trying to address that by scheduling immunization clinics.
Yeah, that's a good point. And right now, the vaccination updates are only able to happen here at the main office, main clinic. And VFC is very strict as far as how the vaccines are handled, stored, and all of that. So for that reason, the best place would be for them to come into the clinic and get their immunization updates done here through a nurse visit, through their well child exam. So we do need the school's help to really encourage that. And the school health personnel, and some of them have nurses, some of them have techs, they do have to track that. Those who are deficient need to be directed to come get an update. And then the public health nursing, they do have somebody who's delegated to oversee immunizations and be in contact with the schools, and also sending out letters to the parents of those who whose children need updates. So I know that it's just within the past couple of months that public health nursing are able to start moving forward on some of the former things that they were doing and keeping track of. So they're they should be in contact with the schools. They're not available this week for the meeting, but Rod is the school health person within the public health nurse team, and he has been in contact with the schools, Rod Antone, and then the other nurses also help with the immunization issues. So yeah, that's a good point though, because people need to update all those other vaccines. We have even with the teenagers, you know, there's the meningitis one, there's the HPV one, and measles, mumps, and rubella, making sure that those are all up to date. Tetanus, Tdap, we have pertussis, you know, things. So but the schools have to submit their reports, and usually we work together to assist, but we don't take any vaccine clinics out as of yet. I don't know if there's any plans for that with the mobile van. I'm not sure. Thanks.
Okay, thank you, Shasta. What about the reservation schools? If you're working with the like CHRs and others to try to disseminate the information on the, you know, the immunizations. So I don't know, as far, and including the health educators.
Yeah, that's a good point. The CHRs are down to, I believe, 2 or 3 staff members right now. So they're very short staff, and they're trying to resume a lot of the home visits and outreach that they were doing before as well. But it's been pretty tough for them because there's like I said, there's only like 3, I think, and in the past there used to be like maybe 7 CHRs. So but I know that if the PHNs need help with like dropping off letters or doing home visits and stuff, they will ask them. They'll ask for their assistance. But we do need to, you know, you bring up a good point, and we do have some events coming up. Luana will talk about those a little later, but I think that would be a good topic to create a poster board on and have presented there for the parents to see, and maybe even get some materials sent to the school so they can distribute that to the parents as well. I think that'd be good.
Very good, thank you. And you know, it's really, really important because even with the teenagers, make sure that they got their HPV and that kind of thing, you know, they get so, I'm sure that they're active in the very early age. So anyways, just bringing those up. Thank you.
Hi, Sasha, this is Janelle. I sent you the positivity rate. We're currently at 12%.
Okay, thank you, Jana. So usually once we go over 10% positivity rate, it's a point where we need to take our precautions, you know, consider that it's more transmissibility around us. So just being aware of that. So 12%, because it was, I think, about 5% around there for quite a while. And some other information Janelle just shared is that we've had no hospitalizations in over 6 weeks. So that's a good thing. We're thankful for that there's been no hospitalization. So just to let you all know, but it is very contagious, just like other viruses. So, really encouraging people to pretty much just stay home when they're not feeling well. That's all I have, Lou, for now, until my next item on the agenda.
All right, thank you. That was a lot of information, but really good information and good questions there. So schools, if you have any questions in regards to immunization, and just check up on the immunizations as well. Like Sasha had mentioned earlier about the deadline that's coming up. So if you have any questions, you could reach out to us in regards to the immunization. Next thing on our agenda is the PHN update, but Rod is not here today. So we're gonna go ahead and table that. Table his update. And his update will change each time that we have a meeting. And then the next portion on the agenda is my updates. So I wanted to share a few things. Let me go ahead and bring them up. That way I'm following. Go ahead and share my screen. All right. Let me enlarge that for you guys. So my school updates, things that I've been keeping track of is our school assessment. We're still at 20 schools out of the 24 schools have completed the assessment. And the assessment is to give us information about the health needs of the schools, hearing of issues that are going on, also about areas of topic to talk to the students, the parents, and the staff. And then our MOAs, we have 23 out of the 24 schools executed. So that's really good. We're just waiting on one. Other things that I am a part of as far as meetings is the Winslow Healthcare Center School Task Force meeting. That's an internal meeting. We have that monthly, and it's the second Tuesday of each month. And then of this meeting, the school health meeting, it's external, and it's going to start happening monthly, and it's going to be the first Wednesday of each month, about 1:30. Other meetings that I'm a part of, Navajo Nation School Leadership Meeting, the Navajo Area School Health Quarterly Meeting, Arizona School Health Meetings, which is going to happen this Thursday. Navajo County Community Health Meeting, and then the FACE program meetings that are scheduled. I have a calendar of events, which is ongoing, and this calendar that I'm creating is with all of our information, things that are happening in the community, for our parents, for our students, health related areas, but also opportunities for programs to set up an informational booth. And then also for the schools, what's going on in the schools. That way it'll give us information on when those possible opportunities come up where we'd be able to set up a booth as well, or do some type of education. Website is still under construction for our youth wellness calendar, community resource about our program, etc. So this is ongoing. We're still, working hard, and we want to get this up and going for a really access for all the schools and parents and students to be able to come to our website and access like really simple information. So that's what we're working on. And it's going to be, this is going to be a huge part of our communication with our community and the schools we work with. School contact listing, that's ongoing. So if you have any updates with your contact information, even emails, we do send a few individuals from your school meeting. Also, any information that we come across, we want to be able to share with the schools. So we have that listserv going. Data collecting, using RPMS, school health index. Health index school assessment, which we did begin in the school year. This is the one that we're using for information. Eye care, YRPS, Fitnessgram. And then on this portion on 10 is planning, preparing for upcoming events for FY23, which is school year 22-23. So planning of the family health nights, and the part that we're getting from here is from the school assessment, the information that each of the schools shared, the 20 schools shared with us and filled out the assessment. That's what we're utilizing. How are we going to be able to communicate with our schools? How are we going to be able to share this information with them to be able to support you as a school? So this is something that we had came up with. The Family Health Night is an evening for education, having parent presentations, and also making it fun for the kids to be able to have fun and learn at the same time. So we're encouraging all the programs to come in to set up an interactive booth. And this is the evening. These are the dates that I have set out. And these are the schools that have confirmed so far. So if your school is interested and would like us to have the family health night at your school, please contact me, and then I can stick your school down here on one of these dates. I will send out an email in regard to those and reach out to the schools personally to see who is interested in having a family health night at their school. So this is a 2-hour event. We're looking at having the event from 5 to 7 p.m. Mountain Standard Time. School collaborating. This is an event where our organization and the schools are going to be working together to make sure that this event happens. That's what makes really a lot of our events successful, is when we come together and create events together, because your parents and have that knowledge, and we're coming in and we're going to support that. And of course, like I said, again, we're using the school assessment to base off of the presentations that are going to be conducted for the parents. So every school is going to be different as far as the presentations. So the school collaboration, working together for a holistic, healthy environment. Using the school assessment as a guide to provide information for students and parents. And this is inviting programs and organizations to set up interactive booths and for parent engagement, for student and parent engagement. Parent presentations will be scheduled throughout the evening for parents. And that is going to be on a separate location than from the interactive booths. Also in planning is basketball camps at the schools during the school breaks with Brown strength and conditioning performance. And we missed out on the fall because we weren't able to get our information out soon. So we're looking at the winter. Going to reach out to the school. So if your school is interested in collaborating together to have a basketball camp for your students, you can reach out to me. If not, I'm going to be reaching out to the schools as well. Employee wellness initiative. According to the school assessment, we see that the employee wellness is very low. I mean, it's not too low, but it's low compared to all the other components. So this is an initiative that I want to start on talking about self-care, for educating the staff about self-care. And I have a project called Self-Care Through Art. So we can work, do my presentation on self-care and then do a pinch pot activity. Target to schedule each school throughout the school year by interest, by request. health education video project. These videos that we're going to be working on will be, that's what we want to put on the website. So really common topics, for example, like bullying. So a lot of our schools ask about bullying presentations. So we want to be able to create a video. That way you can go to our website and then be able to show your students and parents these short education videos. Culture Education Initiative is to work with the schools who are interested in providing enrichment evening activities for students and their families affiliated with the culture education. Engage in community youth emphasize activities, working with our communities. We know that there are some organization and programs working out there already working and really focusing on our youth. So we want to be able to work with them as well. So if you know of a program that's, you know, really reaching out to our youth, and we'd like to connect with them and help in their projects. And then, of course, outreach booth setups during parent-teacher conferences, health fairs, etc. So that is my report. And I'm not sure if anybody has any questions about anything that's on here.
I have a question
Yes.
again. What about, I don't know if you're working closely with the behavioral health, and since we don't have the MSPI anymore, to, I don't know if you're talking about assessments, if there are any kind of assessment that's been done, you know, related to student mental health, and, you know, the mental health problems can affect many areas, you know, with their life and academic achievements and just the overall health. And I was wondering if there are any kind of ongoing support for these students to help them with so much going on, you know, with COVID and continuing, you know, monitoring themselves to prevent COVID infection, all kinds of things that are going on out there. So in helping them to continue with their learning is what I guess I was just wondering about that, if there are any kind of assessments that will be done or is being done. What's meant behavioral health group, what are they doing to help you?
Well, with the assessment that we conducted at the beginning of the school year, to hear how the schools were doing, and there were 4 areas of, let's see, where's my 4 areas that we were asking about, which was what were the top health related issues in the past 4 years, and we said not including COVID. As far as we wanted to hear like even underlining issues with COVID as well. And the other one was student presentations, on what presentations they would like for their students, and then what presentations they would like for their parents. And then of course, what presentations they would like for their school staff. So the number one topic, that combining all of the information from all the schools, the number one topic was mental health. So it was different areas of mental health. So one was like mental health stress, mental health issues from COVID. So a lot of mental health, that was like the number one that came up. Number 2 was just the inactivity, more of the physical activity, lack of physical activity. So that was this one that came in second. With that data, when the schools had listed what areas of concern that they have, this is where we're going to be able to, during the family health night, is to be able to provide a presentation for the parents in regards to these topics. So for example, Delcon School family health nights coming up, and one of them was that they put down is mental health as well. And I have reached out to the Delcon Behavioral Health program there, and they are more than willing to assist in providing presentations as well. So right now, as far as specific assessments for mental health, we don't have that. And that would be a good question. I could ask the schools to see how they're at with that and how their referral process looks, and if they need any support in that area. Or is that going well for them? Is that process working for them? Are they getting enough support? So that's a good question. I'm glad that you asked that, Sally. So I will look into that and get back with you and let you know what I find out from that. But that's a really good point that you made. So I appreciate the question.
Yeah, thank you, Shtasia.
Oh,
This, according to some of the studies, 1 in 5 students, they consider suicide or whatever, in a way of hurting themselves. And I thought that was pretty significant to try to mitigate something, at least to find out a little bit more and intervention activities at the schools. Okay, thank you.
yeah. And we could look into the findings too, as far as, is that a smooth transition? Is that happening? How does it look with our organization too? How supportive are we with that process with the schools? Because we're part of that as well. Is that transition? Are we getting referrals, and how does that look? And do the schools feel like the students are getting enough support, from us, not only from us, but also from other, the only programs that are here as far as mental health is Delcon, Department of Behavioral and Mental Health, and then us. So, that is a really good question. We want to be able to fix that as well, to make sure that the schools, the parents feel that support and not feeling any frustrations when they're going through that process, because it's very sensitive. We want to have like an open door policy where they're going to feel welcome and not hesitate to come to us and ask for help. So those are really good, points. Okay, so thank you again. Appreciate that, Shada. Okay, all right, I see Mary. I see your hand up. And what's your question, Mary?
My question is, on number 1, is Loop part of the completed surveys?
Yes.
Are we completed on the MOAs?
Yes.
Okay.
You're good to go.
Okay, so on the 8th, what we're gonna do, I just got your response on your email. So I'm gonna meet with the principal, and then one of our school improvement things is, how do we get our parents back into our schools? So that probably be one of our parent topics. So we'll kind of narrow it down to maybe 2 or 3. That way it'll help find a presenter. But I see Sally Pete on the Zoom meeting. It's great to hear you and see our CEO on a meeting also. And I think I seen Board of Director also, Alberto, welcome. My name is Mary Freddy. I work with Loop Schools Incorporated, work with the FACE program, and I teach FACE Adult Education, which is our GED program, but I'm kind of the gopher for our school. So there's a lot of stuff for community involvement, collaboration with various stakeholders. I'm involved in all of those. I missed the MSPI program because we were the beneficiaries of the suicide prevention program. We were beneficiaries of the mental health youth first aid. I see Cody's on the line also. I don't know when you guys are scheduling the fitness gram. We can find somebody for that. I think we have a nurse and a part-time AD right now. The youth risk behavioral health survey, I don't know how often that one goes out, but that's one of your mental health assessments that you guys normally do, which is also tobacco and drug prevention also. Let me see what else do I see? Can you scroll down a little bit on your screen? 2-hour events. We do have parent-teacher conference today. That's just kind of last minute. So I'm not sure we're looking for so much people to set up booths today, but we've got a lot going on. We've had half a day. We're having our parent-teacher conference from 4 to 6. Cross-country across the street. Loop Public Schools hosting a NAJHL cross-country meet today. And they're doing it by the softball field. And then Loop Public School is also doing a TBRI, which is basically the social emotional learning facilitation of their program from what they provide for their school. They're doing a 2.5-hour presentation across the street from 5 to 7:30 tonight. We would like to jump on your wellness initiative through collaboration with something with our employees here. A lot of the stuff that we're targeting is more for the youth also, because we're finally back in person full time. It's been interesting because you see a difference in these kids on where we're at socially and mentally, a lot of the mental part. And I'm glad you addressed that, CEO Sally, that it's not addressed. It's still one of those silent things with these kids that we don't have words for. We don't know how to address it. Culture is always excellent. That's why I was asking about the MOA for behavioral health, because I know a lot of their behavioral health comes in with that culture component. So that's something I think for the December 8th project is going to be very helpful, is combining that. But also half of our community are not so much the traditional practitioners, they're more of the church. So kind of half and half on that one. So that's kind of where we're at. Let me see, engage in community, youth emphasize activities. I'll check with, we're starting up basketball tryouts next week. So let me see if one of these basketball camps with Brown strength and conditioning performance works best for us. We might pick, I know we usually have training for ESS in December. So we might pick, kind of highlight us in for March, the spring break. So our spring break actually here in Loop actually does fall on that week, the 13th through the 17th. So that might work because that'll give the parents an extra activity. And I believe that is it. I am so glad I got on this meeting. I appreciate you guys' time. Thank you for everything you do.
Thank you, Mary. Yeah, I wrote you down for all of those. So I'll be contacting you in regards to each of those areas.
I have one more. Shadeja, this is Sally again.
Go ahead, Heather.
You know, I was thinking about the culture, cultural, whatever education that is provided, cultural education initiative. How much is Thomas involved with the schools? You know, even just teaching the kids their clan, their relationship, that would be wonderful to introduce something like that. Maybe Thomas could help in this area. Because I know a lot of them, like some of the students, they come like for the summer program, and they come through the office and I ask them, what is your clan? And some of them don't know, some do. So at least start something somewhere with the cultural education. Thank you.
Thank you for that question, Sally. Yeah, on one of the questions that we had on there is to find out if schools have culture teachers. And if not, we want to work with the culture teachers, but also we want to help the schools that don't have a culture teacher and work with the school on this initiative to how they like to far as move forward with ideas on culture education. And I would like to include Thomas in that planning as well. So thank you. All right, any other questions? Okay, we can go ahead and move forward. Let me get the agenda back up. So next portion on this is new business. And this is COVID response update from Sasha.
Lou, can you let me share my screen? All right. This is a very good meeting. Very thankful for all of you. So wanted to share with you that we have updated the different recommendations and guidance for the schools regarding COVID. And I did get approval from our incident command team, and also so including Peter Vermillier and Dr. Sage White. So there's been changes, and many of you already know about that, with CDC changing their recommendations. And then we always see also what the Navajo Nation Health Command Operation Centers are doing as well. So I will be emailing these documents to you, because I know a lot of the schools still utilize guidance that we provide. So you'll remember, probably recognize algorithm. This would be used for the use of like school staff, teachers, how to respond to COVID-19, and some of the things that we want to continue to encourage is that you're talking to students and staff about washing their hands well. So, you know, if you need hand washing demonstrations and stuff, let us know. But, you know, 20 seconds, and that goes for all of us. Sometimes you just hear the water turn on real quick and turn off real quick. So you're like, did they even wash their hands good? You know, sanitizer stations, and just really encouraging them of when to make sure they're cleaning their hands, watching their distance, wearing a mask, and reporting symptoms. That's a big one. Still with the case investigations, when I get school notifications, we're still seeing that kids may have, you know, tested on Thursday, and then when their positive test comes back and they're being investigated, you know, questioned, the student or the parent would have reported that the child started feeling sick on Monday, but they were still in school, you know, that whole entire time. And so it's important that they're reporting symptoms. I know, you know, a lot of them don't want them to miss school and all of that. I know that's still a concern, but it's important in order to keep other kids well, keep other kids in school, even keeping teachers well, you know, because I know the teachers are, it's hard when they get sick as well. So this goes through the whole algorithm of when there's symptoms, what should you do as a school, and how would you respond? Some of you, actually many of you, have home tests that you still supply to your students and their families, and also to your staff. So, you know, that's an option. Otherwise, you know, they can still come here to get tests. And then what to do if there's a positive and a negative. And some things that have changed is that now there's an isolation time frame of 5 days. So if a person doesn't have symptoms, or they're feeling better and don't have a fever, they can return to school or work. The thing with that is they should wear a high quality mask while they are at school and work. High quality mask is defined as an N95 or a KN95. And so, and that's just, you know, for protection of others, because those masks provide very good barriers of protection between, you know, the person and, you know, their respiratory droplets getting out. So that is the guidance that has come out from the Navajo Nation. And so then there's information there that we have available. This is for the school staff in response. And then this here is based on testing. So if a person is getting tested, whether they're using a home test or the PCR test at their local healthcare facility, and just kind of guiding through. And we've updated this. This might look familiar as well. So it's just going through and guiding, you know, getting the test, after testing, waiting for results, and when you get a negative result. And then here is the one parent handout, because a lot of parents, you know, sometimes still need that encouragement and guidance as well. And we have our 3 W's and our 2 V's. And, you know, people sometimes are concerned about exposure or close contact. Maybe it's within their home or maybe within a family gathering, because those are happening more often nowadays, which we're thankful for because everyone likes to be together as family. But we do need to take those precautions if anybody should find out that they have COVID, they're sick with COVID-19. So it goes through, you know, all the different directions on what they should do for positive results with symptoms, with no symptoms, and then how everyone should wear that high quality mask for 10 days if they have tested positive for COVID. The most common mask they're wearing is the regular surgical type of mask. And so when people test negative for COVID and they were sick, again, we were aware it could be common cold, and we just advise that they return to work or school when they're feeling better and when they don't have a fever. So, but these are the 3 documents that have been updated and approved, and I will be emailing that to you shortly. So any questions? Okay, thank you.
Thank you, Sasha. Really good information. And we will be sending that out to everybody as well. Okay, so next on the agenda is myself. I wanted to share some information about the school health index. I learned this, I learned about the school health index from the Navajo area school health meeting. And so I asked Sasha about it. So she gave me some information about it and where to go to get more information. So I'm not sure if all the schools are utilizing the school health index. And Sasha was sharing that the previous school health coordinator used to really encourage the schools to utilize this. It does generate a report, and this would be really good information, sharing that with us. That way we can see where all the schools are standing. So let me go ahead. I'm gonna share my screen, and then I'm just gonna show really short, 3 short videos. I hope you guys are okay with this. I wanted to show these videos. So the school health index format. The school health index is 2 steps.
Luana, there's no sound on my end.
Was that the same for everybody? Could you guys not hear the video?
Yes, I couldn't hear either.
Oh my goodness. Okay. So what I'll do is go ahead and put the
All you have to do before you share screen is at the bottom is to share the sound. There's an option on your share screen that says share the sound. There's a little box at the bottom.
share sound.
Yes,
Should I try this again?
yes.
Okay. Let's try this again. Let me know.
The
Sound
guys
is on.
School Index consists of 2 steps. 1. Conducting a self-assessment, and 2. Creating
Sound
a
is
plan
on.
for improvement.
It is on?
The self-assessment
Yes.
step leads members of your school community through the School Health Index modules in order to identify what your school is already doing to promote health as well as areas for improvement. The Planning for Improvement step enables you to identify many actions your school can take to improve its performance in areas that received low scores. This step then involves prioritizing those actions to help you to decide which actions to focus on first. Finally, you will complete a school health improvement plan to list the steps you will take to implement each of the selected actions. As you complete the School Health Index and calculate your score, it is important to remember that it is not a research or evaluation tool. It should not be used to audit or punish school staff. What the School Health Index does provide is an improvement plan that can be used to monitor progress and review recommendations for change. The School Health Index identifies low-cost or no-cost improvements to a school environment. The self-assessment process is a focused, reasonable, and user-friendly experience. Completing the School Health Index is an important first step toward improving your school's health promotion policies and practices. Your school can then act to implement a school health improvement plan and develop an ongoing process for monitoring progress and reviewing your recommendations for change. Habits and practices related to health and safety are influenced by the entire school environment. The School Health Index is composed of 11 modules that are structured around CDC's and ASCD's Whole School, Whole Community, Whole Child model. The WIHCC model emphasizes a school-wide approach to student health. The modules are School Health and Safety Policies and Environment, Health Education, Physical Education and Physical Activity Programs, Nutrition Environment and Services, School Health Services, School Counseling, Psychological and Social Services, Social and Emotional Climate, Physical Environment, Employee Wellness and Health Promotion, Family Engagement, and Community Involvement. The first step to completing the School Health Index is to understand the modules. This course will provide an overview of the modules and exercises to complete an example module. The School Health Index also has instructions that will help guide you through completing each module to assess how well your school is meeting the opportunities available in that area. There is no single way to implement the School Health Index. Schools have developed many approaches based on what best meets their needs. Now that you are familiar with the School Health Index modules, you are ready to start the assessment process. Here are the steps that you can use or modify when implementing the School Health Index. Assemble a School Health Index team, which includes identifying a coordinator to lead the effort. Conduct a School Health Index introduction meeting. Complete the self-assessment modules, and complete the overall scorecard and develop an improvement plan.
So those are the videos I wanted to share to kind of do an overview of what the School Health Index is. And I think this would be really helpful as far as finding out at your own school, what is it that you're already implementing, and strengths, and also weaknesses as far as what support isn't being done, and then what does that plan look like to be able to provide, those, with the components, which area of needs for the schools. And this was the question that we had. The question as far as the components were in the school assessment that we did, and that's where we saw that all of the schools, that employee wellness portion was very low. So that's the reason why I thought about the initiative to go ahead and provide one area of education for all the schools. So this would be really helpful. And then once the schools get this done and completed, they have a team and they're working together to move forward. And then what will happen, Sasha said, is it generates a report, and you can share that report with, asking if you could share that report with me. That way I can look at that too and see how we could be of support for each of your school. So I just wanted to share that with everybody. And also in the chat, I did put the link to get to those videos. All right, that's what I wanted to share. I don't know if anybody has any questions about this portion. And if not, I can move on to the next area. All right, okay, so the next portion is upcoming school calendar. And this is the one where I want to show everybody the calendar that I was creating for all of us to be putting our information in here. So for the remainder of October, so today's the 19th, I have the school health meeting here. Tomorrow we do have our victory clinic. On the 22nd, Fall Festival, Red Sands is having their fall festival from 11 a.m. to 3 p.m. On Tuesday next week, Halloween Carnival at Delcon School. Doma Doom STEM Family Night at Jefferson School here in Winslow. Connection Study at Red Sands. Family Health Night event, that's going to be at Jedito. That's our first Family Health night event that's going to happen for this school year. Then another Connection Study, Victory Clinic, Halloween in the Park here in Winslow. Truck or Treat, sponsored by Delcon Police Department. Halloween Carnival at Loop Schools Incorporated on the 31st, and then Halloween parties at Little Singer School. November school health meeting will be, this is when we start the monthly meeting, so school health meeting on the 2nd. We have the Winslow Unified School District Native American Festival from 10 a.m. to 5 at the Little League Field. Bonnie Brennan's doing a climathon. And then this is our school health task force meeting for the month of November. They're free showing at the Winslow Theater for Winslow Unified School District kids. Well, I think it's open to the public, but this is in regards to the Native American Heritage Month. So they'll be showing 3 Native American movies. Let's see. Family Health Night at Delcon School is going to be on November 15th at Delcon School. And Winslow High School having a counseling meeting, which I attend as well. And then Winslow Christmas Parade on the 19th. Let's see if we have anything for December. Family Health Night, Loop Schools Incorporated, the meetings. So far it's pretty blank. So if you have anything going on at your school and you like resources, community programs, we'd be able to set up an outreach booth, or either if you know something that's going on in the community, you know, to get the word out, let me know, and then I can put it in our calendar. So this is we want to start doing this. That way we can see what other schools are doing. We can see what's out there, and also a way of communicating with our programs. And I can share this too with all the individuals that attend the meetings. All right. Anybody have any questions on here? Want to add anything to the calendar? Nope. All righty, we'll go on to the next one, which is announcements. Does anybody have any announcements they'd like to present right now? No? Okay, that's good. So our next meeting is scheduled for Wednesday, November 2nd, 2022 at 1:30 p.m. And then, so meeting, that concludes our meeting. So it's 2:11 p.m. All right, thank you everybody for attending. Appreciate everybody's input, and I hope you all have a great rest of your day.
Thank you, Luana.
Thanks.
Thank you.